the gratitude all of us have for what the Takacs Foundation has done over the past decade here, it's hard to put in words. The faith that they had when they said, okay, we think you're ready to do this locally and to step up, and hopefully they feel that we honored our promises and continue to honor those every day in her memory. It is, again, it's one of those diseases it's hard to treat alone. That's why we have a team, and we truly consider the Paula Takacs Foundation part of our team in taking care of sarcomas here in the greater Charlotte region.
With Paula's messages, she wanted to have impact in her community with the disease that was affecting her and her family, and that was her vision. And we just had to all step it up to make sure that we could do that.
The way that funding in this country works for rare and complex cancers like sarcoma, it's, to sum it up, it's just not available. There's very few trials. Patients are spread out everywhere, so there's a lot of collaboration that has to happen. And because of the support of the foundation, we are able to make kind of a competitive bid to be involved in that, because we can help support our own.
The Paula Takacs Foundation provided support financially to perform this Phase 2 Sarcoma Research Initiative. It was using doxorubicin and pembrolizumab to treat patients with unresectable sarcomas or stage 4 metastatic sarcomas. So in cancer research in general, we're looking to find other ways to pair chemotherapy with more tolerable treatments, or do chemotherapy-sparing treatments entirely. And that's the importance of being able to pair doxorubicin with other therapies that are not chemotherapy agents, like pembrolizumab, which is a type of immunotherapy. It doesn't have the same toxicity as traditional chemotherapy, and so it's usually more tolerated. So that study was to look at the combination, make sure it was tolerated by our patients, and then to see if it actually provided good benefit for our patients. And we were very pleased with the results. So with the support of the Paula Takacs Foundation, we will continue to do research to look at the drivers of sarcoma, because ultimately, with cancer research in general, we're starting to evaluate the importance of targeted therapies, and that's particularly important for sarcoma.
When I see patients who have a new diagnosis of sarcoma, very few of them have had any experience or any knowledge about sarcoma as a family of cancers. And their understanding of cancer generally is an understanding of a cancer like a carcinoma, breast carcinoma, lung carcinoma, in a friend or a family member that might have migrated to their musculoskeletal system, but really most people do not have an understanding that the tumor can actually originate there.
The thing that people need to advocate for is when they have a mass that they notice is growing. So a mass that has been stable for 15 years, very unlikely to be an aggressive tumor or anything bad. But something that over a 3 to 6 month period of time is showing progressive growth, or something that was previously noticed that is starting to grow, those are the times you need to sort of raise your hand and ask for a little bit deeper dive. When a patient is first diagnosed, there's differing times and different routes that people are diagnosed. But once they're diagnosed, I think an important thing is to find a high volume cancer center. We're lucky enough in our community that LCI is a very high volume, amongst the highest in the country in terms of treating sarcomas. So we know what we are, we know the treatment algorithms, we know the pathways that people should go down. So you want to make sure you're being taken care of by someone who does this on a frequent basis, because as we talked about, it's a rare cancer. Coming in asking questions, being informed, understand what does a grade of a tumor mean? What does the size of a tumor mean? What studies or what areas of the body need to be checked for sites of other sites of disease or spread. Those are all really important things up front. I think if you look at the phrase "stronger together," it is very similar to how we look at the evolution of our cancer center in general. Back when we started the sarcoma program, I say we, when Dr. Niesel started the sarcoma program, it was one man. And he recruited people to help. He built the tumor board, and that we know having that collaborative effort creates a better care environment, creates better care for each individual patient as well as the community. Looking at how they build community, the Sarcoma Stomp is a great example of that. And that event is, without question, one of my favorite events of the year. I mean, I still see patients there who are survivors. I see families of patients who unfortunately didn't survive, who still show up, and they like having that sense of community, that galvanizing entity that really brings people together. And that's part of the reason why they've done such a great job supporting us, is they've really kind of created this sense of community around that orphan disease.
I think there's hope with discoveries in other types of cancer with targeted treatments that survival can be improved, and we're still trying to understand that for sarcoma patients. So my vision is that in the future we can utilize our great resources here, including the biobank as well as our molecular sequencing core and our immunology core, to further understand the mechanisms that drive sarcomas and find better treatments. If by the end of my career we could say that we meaningfully improved the survival for some of these patients, I think that would be a wonderful accomplishment. And I look forward to working with the Paula Takacs Foundation and trying to unlock these discoveries.